Good health tips. Welcome to You and Your Health, your ultimate destination for everything related to health and wellness.
Hypoglycemia is a medical condition that occurs when the blood sugar level becomes abnormally low. The normal fasting blood glucose concentration is between 70 mg per deciliter, 3.9 mmol/L, and 100 mg per deciliter, 5.6 mmol/L. It is not good when the blood sugar level falls below 70 mg per deciliter. You may start seeing signs and symptoms of low blood sugar or hypoglycemia when the sugar level drops below 55 mg per deciliter. Hypoglycemia is a common complication in patients with diabetes who take insulin or other anti-diabetic medications to manage diabetes. People with diabetes can experience hypoglycemia when they take insulin or anti-diabetic medication without eating or not eating enough. Moderate exercise is good for managing diabetes, however. Engaging in excessive exercise or physical activity without eating, not eating more, or not adjusting their diabetic medications can lead to hypoglycemia. Physical activity makes the body more sensitive to insulin, helping the body cells effectively absorb more sugar from the blood, thereby lowering blood sugar during or after exercise. Some people without diabetes can also experience hypoglycemia. Non-diabetic hypoglycemia is a low blood sugar that occurs in people who do not have diabetes. This may be due to anorexia, which is an eating disorder. Excessive alcohol consumption without eating. Research shows that medications like beta blockers, heart arrhythmia drugs, quinolone antibiotics, quinine, and pentamidine can cause hypoglycemia. Also diseases like hypothyroidism, liver disease, kidney disease, tumors in the pancreas or insulinomas. Hyperinsulinemia, or congenital hyperinsulinism can cause hypoglycemia. Prolonged hypoglycemia can cause brain death or encephalopathy because sugar is the fuel for brain function. Prolonged hypoglycemia can also cause severe arrhythmia and ischemic cardiovascular attacks and even death. When the body is in a hypoglycemic state, you will see signs and symptoms like excessive sweating and hunger, fainting, fatigue, lightheadedness, or shakiness, nausea and vomiting, mouth dryness or tingling lips, confusion, slurred speech, blurred vision, unresponsiveness, seizures, and coma, anxiety, headache, irritability, pallor, palpitations, the sensation of pins and needles, sleepiness, tremor, or unsteadiness. It is important to recognize the signs and symptoms of hypoglycemia for prompt intervention. If you are a patient with diabetes and you have a glucometer or a blood sugar monitoring device, it is advisable to monitor your blood sugar level at least 2 times a day to prevent hyper or hypoglycemia. People experiencing hypoglycemia but are conscious can eat simple carbohydrates such as cookies, candy, or juice to raise their blood sugar levels quickly. For an unconscious patient without an IV line, glucagon injection will be the preferred intervention. If the unconscious patient has intravenous IV access, then dextrose can be the preferred intervention. I hope the video is helpful.
Thanks for watching. Like, comment, subscribe, and share.